injured my knees in high school and college. So my left knee I injured while downhill skiing, and my right knee I injured while playing indoor soccer on a rubber surface. So those were somewhat permanent injuries at the time. I had my right knee reconstructed, but of course with my continued activity, it was re-injured again, even wearing knee braces and trying to do physical therapy and still remaining active.
Once they're struggling with activities of daily living and their pain is really affecting their quality of life, that's when it's time to go ahead and proceed with the surgery, because after a short period of healing, they really can improve their function and get back to doing those activities that they really miss.
The funny thing is that just even taking simple steps as I walk sometimes, since my knee is going off to the side so far, I feel that I just can't wait to actually have a balanced, sort of synchronized step again.
Modern designs of total arthroplasty components now, or joint replacement components, are lasting longer than they ever have. And so we're seeing longer and longer survival of the implants, which means less revision surgeries down the road. And so now we're starting to do joint replacements in younger patients than we did in the past.
Well, I think the doctors have really taken time and energy to go through my x-ray and really point out all the areas that were failing or doing worse, and how a total knee replacement versus a partial replacement was needed. And that kind of attention to my specific knee was really comforting, and realized that they are looking at everything to make this surgery go well.
I would say most patients are nervous about getting back to where they were before, say they had an injury or the arthritis. A lot of people think even if they were to go through a surgery, they may not get back to that point.
People put off surgery often because of the fear of having surgery, the pain that accompanies it, and that sense of losing their independence. I think once they get here, they realize it's not as scary as they thought, and really are excited to then have their procedure done.
The number one thing I thought that raised my comfort level for the surgery was the fact that they do this regularly, and that the care is right here in our city.
A lot of patients will say that the pain that they feel post-operatively is a lot less than that pain that they've been walking around and dealing with for years.
The benefit for him is it's not going to be his knee limiting him if he wants to be out and active with his kids or his family or at work.
So I may be younger than most people getting knee replacements, but recently my father actually had both of his knees replaced, and I can see that his quality of life has already improved. And when my dad can go out skiing with my kids and I can't, that's kind of hard to see that. Or my brother wants to go skiing with my kids and I can't. It makes me realize that I need to do something earlier, because I'm already limited in what I can do, and that by doing this, it will give me the chance to do a lot more.
So the operation that Eric is undergoing is performed by removing the ends of both the femur bone and the tibia bone, as well as the undersurface of the kneecap. And those three surfaces are replaced by a prosthetic joint, essentially, frictionless surface that allows the knee joint to glide almost like the cartilage would. And this will provide stability to the knee and also remove the painful ends of the knee where the arthritis was.
You're coming here to get a new joint, and it's a new chapter for you. You can do things that you've not been able to do for years and finally get that back. We do a discharge class, and in there we show a video of a guy skydiving after he got his hip replaced. So really the sky's the limit once they get that joint replaced on what they're able to do.
It's very important for the patient to really have a buy-in to a surgery like this if they're undergoing a joint replacement. And it kind of starts with having the patient meet with even our physical therapy team before surgery and already start working on strengthening their leg, because that really does help them recover after the surgery.
Everybody knows their place, and part of that is including the patient in their care. That they're part of this experience, but we're their biggest cheerleaders. We're here rooting for them to make sure that they're very successful and that this joint lasts them a really long time.
Well, my kids have learned how to ski pretty well from me on the sidelines, but I think it's going to be even more fun that I can take them up onto a mountain and explore, the Colorado Rockies with them in skis, or even just, be able to have a little more time to go through and help them with their carving turns and bring them up to another level of skiing that they can't just get on their own.